Hi, I'm Dr. Kelly, and I just wanted to take a moment to share with you why brain health has become such a passion of mine and why I was compelled to write the Beginner's Guide to Brain Health. First, I'd like to just share a little bit of a story. This is a story about my grandmother who lived in North Dakota. She was one of the most vivacious people you would have ever met. She always was dressed to the T, had matching jewelry, had her hair perfectly done, always wore makeup, never saw her without it. She took a lot of pride in herself and, of course, was raised that way. She had 5 children and 15 grandkids and could tell you anything and everything about each one of us, including what the latest happening was that was going on in our life. She was a very active person. She always walked. She was very active in her community as well, involved in several different clubs in officer positions. She was part of crafting clubs and did a ton of quilting. She actually made 100 quilts during her lifetime, the last of which was made for my son, which I was blessed to get. And man alive, was she competitive. She could whoop your tail at pretty much any card game or any other dice game, like classic game. Not the video games, right? These are grandma games. But she could whoop you, and she had no mercy. It was hysterical and sometimes very frustrating. She did a ton of word games and the Sudoku puzzles, just very active, very busy, sharp as a tack. And then my grandpa, the fall before they were getting ready to retire at the young age of 65, suffered a massive stroke. Because he was so healthy, is what the medical profession said, is the reason why he was still alive after having such a massive stroke. They claimed most people would have dropped dead before they actually hit the floor. My grandmother's life and my grandpa's life changed dramatically from thereafter. He was left paralyzed. They had a farm in the middle of nowhere, in a tiny town in North Dakota with just 350 people in its population, including the surrounding farmers. And they had to pick up and move into a bigger town that had a nursing home to be able to care for my grandpa. The money they had worked so hard at to get ready to start traveling during their retirement now dramatically shifted towards being able to care for my grandpa. My grandmother spent a ton of time in the nursing home. My grandpa was her soulmate, and she never slept another night the same because they always slept spooning. And the amount of emotional stress that she went through really started to eat away at her health as she watched her husband, my grandpa, waste away in the last remaining years of his life in the nursing home. The grandmother that I described to you a moment ago is not the grandmother that ended up passing. She no longer had zest for life. She was eating very high carb, low fat diet. She developed high blood pressure and heart disease, even diabetes. And the doctors continued to put her on more and more medication. I remember at one point we counted at least 8 different medications. She no longer was being active within the community. She quit doing a lot of her crafts and wasn't involved in clubs. She became very sedentary from her day-to-day life, and a lot of that was spent sitting side by side with my grandpa, who was basically confined to a wheelchair or his bed at the nursing home. Through this, she started not remembering things as well. My grandmother, who could tell you anything about anybody, was starting to forget people's names, what day it was, what she did last week. She would even forget if she had just called you, and also seemed to lose track of what time of day it was because she began to call us at all hours of the day. One of the saddest, just most devastating things in our family, because it was such a tradition and something she was so known for, was when she forgot actually how to sew. That last quilt that was gifted to my son as his baby blanket, my great aunt actually had to finish because my grandmother had forgotten in the midst of putting that quilt together for him how to complete her work. She ended up in that same nursing home that my grandfather ended up wasting away in. And I remember when we went to visit both my grandpa and my grandmother very early on of how just not a fun place nursing homes are. My hat's off to people who can work in that environment. It's very depressing. I always, as a young child, when we went and visited my great-grandmother, who was my grandma's mom, she merely went into the nursing home because in the area of town where she was at, they didn't have assisted living. You either lived on your own or you went to a nursing home. And at 99 years old, she didn't think she should be living in an apartment by herself any longer. Sharp as a tack, hilarious, died of just old age. And I remember when we'd go visit her at a young age, my brother and I, we did not like that place. It was creepy to us. And it also just was very sad watching, grandparents sitting at a lunchroom table with their head down asleep. And just horrible. If you've been to a nursing home, you know what I'm talking about. Well, I remember visiting my grandmother one of the last times that we were able to, and she wasn't in her room. And we walked out because we assumed she was in the lunchroom, and my grandmother had become that person who I always thought was just so sad when we'd visit. She was asleep at the lunchroom table, and she didn't even remember who we were. She had no idea who my dad was. And it was just jaw-dropping, like, how in the world did this happen to my grandmother? So fast forward past them both passing, I knew because I already was in this realm of, alternative healthcare and knew what it had done for me and was continuing to learn the influence about diet and lifestyle and nutrition. And we tried to get involved with managing some of my grandmother's care before she ended up in the nursing home from afar, but it was difficult because my family who was helping take care of her before she went into the nursing home didn't have the same education and wasn't completely on the same page, and it wasn't easy to change their world and their viewpoints. They did the best that they could, but also my grandmother was a very strong personality, a very stubborn, amazing woman, and she was not going to deviate at all from what our medical doctor was saying. So I was kind of up against, a rock and hard place. So with what I continued to learn, once everything ran its course, I stepped back and I was trying to determine, okay, what exactly led to my grandmother being one of those people in the nursing home that always just broke my heart anytime I saw them. And what I looked at when I looked at her world was, one, she had incredible emotional stress with handling what life threw at her and my grandfather after he had had his stroke. So that is very devastating on the body, and stress is one of the number one reasons for all doctor-related visits, or for stress-related illnesses. 90 to 95% of visits to the doctor are because of stress. So that was a huge piece of it. But then I looked at her diet, and one of the things my brother and I were talking about this was she really declined when she went into the nursing home, and not knocking the nursing home whatsoever, but looking at the diet she was eating, it was already on the side of being low fat, high carbohydrate, but that very much so increased when she went into the nursing home. And I believe that was a big component with what I know now that led to that demise. And then the fact that she continued to go on more and more medication, that didn't help matters either whatsoever. And then just looking at other aspects of her life, there were things that had I known earlier on, I do believe, as long as my grandmother would have been willing, that we could have changed the trajectory of both her and my grandfather's health. And I didn't want anybody else to have to go through that reality. And the scary part is dementia and Alzheimer's is just continuing to increase and basically soar. With the amount of diabetes we have in America, you will see the amount of dementia and Alzheimer's climb dramatically as a result. We know now that if you have diabetes, you're twice as likely to end up with dementia and or Alzheimer's. Dr. David Perlmutter, who's one of my mentors, has done a ton of work in this area and would really like to rename dementia to type 3 diabetes, because honestly, that's the next presentation of that disease process. So learning everything that I did and also my own personal experiences, I've given myself a couple of doozies of concussions and had the whole pregnancy brain thing that my moms told me would never ever come back even after my child was born, and it was completely unacceptable for me to not have an impeccable memory. My personal experiences firsthand, but also witnessing what happened to my grandparents, is why this has become such a passion of mine. I know, because I've witnessed it also, that that does not have to be the course of somebody's life. I also know dementia and Alzheimer's are 100% preventable, and that short-term memory problems, forgetfulness, lack of focus and concentration, we write off so easily as, I'm just getting older, or my life is too busy, I've got too many things on my plate. We write it off. And really, those are the first signs and symptoms of heading towards that path of dementia and Alzheimer's. Here's the best part. It is 100% reversible when you catch it early, completely preventable as far as dementia and Alzheimer's, regardless of if it seems to run in your family. It's what you do every single day that dictates what your health outcome is going to look like. You do not have to buy into the "I'm just getting older" excuse. Or you do not have to buy into, well, it's in my family, so more than likely this was going to be my future. That is why I've written this book. I knew I needed to have a voice that could reach beyond the walls of my office, which I've been sharing with my patients, and we actually do brain health testing in my office, and we do lifestyle and dietary and supplement recommendations, and we have changed people's lives over here. I wanted to reach beyond my four walls and have a bigger impact to try to change the trajectory of more people's health. So this is why I have written the book, A Beginner's Guide to Brain Health. It is written with applicable information that you can start tonight and begin changing the trajectory of your health. Not only will your brain health improve, which means your memory is going to become clear again, you're going to be sharper, have more clarity, more focus and concentration. That brain fog is going to begin to go away. There is a multitude of different health benefits that are going to come to you and your family if you will take this information I am sharing with you and implement it. Take it one day at a time, one step at a time, and before you know it, life could look dramatically different for you, and the quality of your life is going to soar. So I hope that you will find this information valuable. Please share it with any of your loved ones or somebody that could also benefit from this information, and help me be able to change more people's lives in a dramatic way. I appreciate you. I am grateful that you're here. I'm excited for your journey, and don't hesitate to reach out and let me know how it's going, what questions you have, if you've got any, areas of confusion. I am here to help you change your world and to give you back quality of your life. Can't wait to see you, and here's to being healthy.